Hello, my name is Mariam, and today I will explain how Ambien, also known as zolpidem, works in the brain to reduce sleep and how it can sometimes lead to unusual behaviors like sleepwalking. Zolpidem is commonly known as Ambien. It is a known benzodiazepine hypnotic drug used to treat insomnia. It was developed as a safer alternative to older sedative drugs like benzodiazepines with the goal of reducing side effects and dependence. Zolpidem was first approved by the US FDA in 1992 and is typically prescribed for short-term treatment of sleep problems. It is a fully synthetic drug, meaning it is made in the lab rather than derived from natural plant sources. Zolpidem produces important effects across behavior, cognition, and mood. Behaviorally, it decreases the coordination and reaction time and can lead to impaired movement, as well as complex behaviors like sleepwalking. Cognitively, it impairs attention, working memory, and the ability to form new memories. In terms of mood, it causes sedation and reduced alertness, and with repeated use, it can lead to dependence and withdrawal symptoms. Zolpidem is most commonly taken orally before bedtime because it works quickly to help people fall asleep. It is rapidly absorbed in the GI tract and reaches peak levels within about 1 to 2 hours. Although food can delay its absorption and reduce its effectiveness, the drug is highly protein bound and crosses the blood brain barrier to produce its sedative effects. It has a short half life of about 2 to 3 hours and follows first order elimination, which helps reduce next day drowsiness. Zolpidem is metabolized in the liver mainly by the CYP3A4 enzyme and excreted as inactive metabolites in the urine. Factors like sex differences and drug interactions can affect how quickly the drug is metabolized. Zolpidem works by interacting with the GABA neurotransmitter system, which is the main inhibitory system in the brain. It binds specifically to GABA A receptor, especially the alpha 1 subunit, and acts as an agonist to enhance GABA's effect. This increases chloride ion flow into neurons, causing hyperpolarization and making the neurons less likely to fire. And as a result, overall brain activity is reduced. Decreasing in the neural activity explains the drug behavior effect, such as sedation, sleep induction, memory loss, and reduced attention, as well as in some cases, zolpidem can also alter normal sleep patterns and can cause partial arousal from deep sleep, which may lead to parasomnias, like sleepwalking, where movement is active but awareness and memory are suppressed. Zolpidem also shows limited tolerance to cognitive and psychomotor effects, but behavioral tolerance can develop, meaning patient may need higher doses over time for sleep because it repeatedly enhances GABA activity in the brain, and over time the brain adapts by becoming less responsive to the natural inhibitory signals, which leads to tolerance. And withdrawal symptoms can occur when the drug is stopped, including like rebound insomnia, anxiety, and in rare cases, seizures as well. Evidence also shows that zolpidem has real dependence potential, especially with high doses or long term use, and in some cases, it can resemble benzodiazepine dependence. This occurs because chronic use alters the GABA A receptors activity and reducing the brain's natural inhibitory signaling. Zolpidem has a moderate abuse potential. While it was originally thought to have a low risk, more recent evidence shows that it can lead to abuse and dependence. Its rapid onset and calming effects on the GABA system makes it reinforcing, especially at higher doses. In some cases, it can even produce euphoria, which increases the risk of misuse. Clinical report shows that individuals may increase their dose over time and experience both tolerance and withdrawal similar to benzodiazepine addiction. And based on this evidence, zolpidem is like not harmless and its abuse potential is significant, particularly with long-term or high dose use. These are the sources I used for my presentation. They include peer-reviewed journal articles and a medical database sources, which provided information on zolpidem's effect mechanism, pharmacokinetic, and abuse potentials. All of the information presented can be traced back to these sources. Thank you.